You're at home, completely alone, watching television, perhaps a captivating soap opera or an exciting soccer game, and quite suddenly you begin to experience significant chest pain. These are indeed the alarming signs and symptoms of a potential heart attack. What exactly would you do if you found yourself in this critical situation, all by yourself? There are, in fact, 7 crucial steps you should immediately take to significantly increase your overall chances of survival. This is extremely important. And you can't make too many mistakes, which I'm going to mention here. As an endocrinologist, I worked for many years in emergency medicine, responding with medical ambulances. So when you called for emergency help, I was the one who answered and went to provide assistance. So I know exactly what the main mistakes are and how to avoid them. So pay close attention. This is one of the most important videos on the channel, if not the most important, because I'm going to share a lot of scientific evidence as well as what actually happened in practice. There are 7 steps that can save your life, and you need to know all of them. Well, when it comes to a heart attack when you're alone, there's something that's extremely important, which is to recognize and not ignore the key symptoms. That's step number 1. And what are the signs and symptoms of a heart attack? Chest pain, and this pain can feel like pressure, tightness in the chest, or even a burning sensation. It's very important for you to know this because sometimes one person will feel a burning pain, another will feel a heaviness in the chest, and someone else might have a pain that's different from these. So, chest pain is always important. That's what I wanted to mention here. What other symptoms can come along with this chest pain? Nausea. This is very common. I've treated patients with heart attacks. Oh, I'm having chest pain and feeling really nauseous. That's another warning sign. Other signs, numbness in the jaw. That can happen too. Difficulty thinking, mental confusion, sweating, chills, palpitations, tremors, shortness of breath, trouble breathing. All these signs and symptoms are extremely important. And that's the first step, knowing how to recognize the signs and symptoms and not ignoring them. As an emergency room doctor, I would ask, when did this chest pain start? Oh, it's been 2 hours already. It's been a long time. Wait, but why did you wait so long? Oh, I thought it would go away. I kept doing my usual things, but it just didn't go away. So don't wait. If you have this pressure that I mentioned, you need to follow these next steps that I'm going to explain in the video, okay? So don't make the mistake of thinking it will just go away. If you're in doubt, you should go to the emergency room, all right? Because the heart attack is a very serious thing. In many places around the world, cardiovascular causes are number one. So pay close attention. The second step after you've identified it, after you've recognized the possibility and haven't ignored the signs and symptoms, is that you should sit down with your knees bent in what's called the W position. Support your back. This is very important so you don't fall or faint, which happens a lot. People have heart attacks because of decreased oxygen supply. And if you can, with your back supported, bend your knees. If not, just stay seated. That alone will help prevent a lot of complications. If you're near a staircase, for example, make sure you're in a safe place. The third step, and this is extremely important, after you've stopped what you were doing, you need to call emergency services. Depending on the country you're in, there's a specific number, but it's the emergency ambulance number. But that's not all. The main tip here is this. You heard in this video that I answered calls from people asking for help. They were alone, and many couldn't give the necessary information. Where they were, a correct address, why is that? Because normally you can give your identification, the number, but you have time. But when you're experiencing a severe heart attack or a sudden cardiac arrest, you also heard that the crucial heartbeat, the heart's vital blood supply, and its essential function all get significantly compromised. You might get confused and have trouble giving information. Many times when I asked, but what's the house number? It's near what? Tell me. The person would give generic information. They couldn't say the number. And also information about the street, like how to get to the house. Or they would give imprecise information. You know that tree, the Jabuticaba tree? That tree and all, you have to turn left, then it'll be in front of my house. That's really hard because a lot of times the doctor, they're still going to pass the information to another doctor who's in the ambulance. There's that issue too. And even if the doctor himself is answering the phone and is going to do the rescue, it's really hard for him to have to explain to the driver, you have to go by that tree and then you see that sign and so on. So you can't just pass on information verbally. You need to have a note on your phone or a physical card with the address and all the details so the paramedic can get there. Otherwise, it gets really hard. But it's easy to have a note ready with all the information and ask the person if it's clear. Because sometimes you live in that area all the time, you already know all the nuances, all the details. But for someone who's not from there, it's really hard to know. So call emergency services and give the address that way. Either copy and paste it or just read the information out loud. If you're alone, especially as time goes by, you might get confused and it can get really hard. I've experienced this myself, and many times it made it impossible to get help. If you don't know the address, how is help supposed to get there? Or if it takes longer to get there, they'll have to keep looking for the place. So that's really, really complicated. And let me also say, if you have a car, don't drive yourself to the hospital because you could have a complication on the way. And then, yes, that can lead to other also very serious consequences. So don't drive yourself, okay? Call for help, call an ambulance. And that's also the first thing you need to do. You can set it as a shortcut, call emergency services, or ask someone to set it up for you if you don't know how. And then you learn how to use that shortcut. And it's also important that the first thing you do is call emergency services. A lot of times people would call their kids, their husband, call uncles, neighbors, a bunch of people. And when someone finally answered the phone, they'd say, "Oh no, I've already told so and so, he's on his way." No, the first thing has to be calling emergency services. After that, you can notify other family members. And step number four, which is very important, is to unlock the doors and open the gate. This also happened. A person would call, manage to give the address, do all the steps I mentioned, but when I got there, I would find all the doors locked. That makes it much harder to provide help. So you need to leave the doors open, the gate open, and be careful if you have a dog. Take all these precautions, which can be really complicated in an emergency. So think ahead. This could save your life. Step number five, after you've done all that, and also very important, is to take aspirin. But how are you going to? Take the aspirin and you should chew it. What's the dosage? If it's the children's aspirin, you should carefully chew 3 individual tablets, which will collectively be 300 milligrams. If it's an adult tablet, 300 milligrams, then just one is enough, okay? But it's important to know the dosage, which is 300 milligrams. And you should chew it, okay? Don't swallow it. Why? If you chew it, you increase the effect and how quickly it works. What's the importance of aspirin? Because when you're having a heart attack, when you're actually having one, there's a blockage of blood flow. And aspirin, as an antiplatelet, acts on platelet aggregation. It helps with the clotting process, preventing further clotting and making the blood thinner. In simple terms, that's what it does. Of course, if you don't have any contraindications, if your blood isn't already too thin, if you're not already taking other blood thinners, and if you're not allergic. Because also, if you have any allergies, then you shouldn't take it. I always suggest this to patients who are at high risk of having a heart attack, or who have the possibility, who have risk factors like diabetes, high blood pressure, who smoke, who are sedentary, who have high cholesterol, or a family history. If you have any of these risk factors, talk to your doctor. I recommend this to many patients, to have aspirin at home for emergency situations. And it's important to point out that when you take aspirin for prevention, many times the cardiologist will recommend it, but it's usually a dose of about 81 milligrams. You saw that the dose for a heart attack is 300 milligrams. So there's this difference because when you take aspirin routinely or continuously, if you're protected in case something happens, right? So you need to keep that in mind. So if you're not at home and you don't have any relatives who can talk to the doctor, you can take it in case of an emergency. Number six is about other medications. Have you ever heard of Isordil, nitrates, or medications to lower blood pressure? Have you heard about that? There are a lot of videos made by non-doctors or even doctors who don't understand emergencies telling you to take Isordil or other blood pressure medications. The answer is no, okay? Other than aspirin, at the moment of a heart attack, don't take anything else. Why? Depending on where the heart attack is, a vasodilator could actually make things worse. A sudden drop in blood pressure, for example, can actually increase your risk of death. So keep that in mind. During a heart attack, it's not the time to self medicate because these medications can actually make things worse depending on where the heart attack is happening in the heart, where the blood flow is being blocked. Taking a blood pressure medication could actually make things worse and lower your chances of survival, okay? So, other vasodilators, other medications without medical supervision, you should not use during a heart attack. Since I'm talking about what not to do, there are a lot of rumors and false information about the cough protocol. Have you ever heard about that you have to cough in a certain way or do this or that to increase blood flow? The answer is no, okay? There is no strong scientific medical evidence to support that. So forget about this cough protocol or cough CPR, which is for cardiorespiratory, okay? Forget about that and also about other medications. It's very important because this can also increase your chances of survival, not doing the wrong thing, right? And number seven, after you've already done all these steps I mentioned, is to know that you really did the right thing and breathe calmly. Avoid panic and anxiety because you did everything you could. You've already increased your chances of survival, which is extremely important. So stay calm, breathe slowly. Adrenaline, nervousness, and anxiety are extremely common in these situations and also increase your risk of death. It makes your condition worse. So breathe calmly. You've done everything you needed to do. Now, all that's left is to wait for help to arrive so they can assess what's happening and see if any other measures or medications are necessary. And then, yes, with medical supervision. But a heart attack on its own is a big problem, and we need to talk about it. Do you have any other questions? Have you ever had a heart attack? Were you alone? Were you with someone? Tell us here how it was. Or did you have chest pain? Did you get any testo? Or maybe you didn't seek help. Share it here. This is really important. Also, mention which part of the world you're speaking from. I'm speaking from Porto Alegre. Comment down below. Now, I'm going to leave a recommendation for you to watch. It's a video where I talked about the signs and symptoms of cancer. Did you know that just like a heart attack, which has early signs and symptoms, cancer can have them too? And if you identify them, you greatly increase your chances of survival. Just like with a heart attack, the key is always to identify it early. Do you know what the signs and symptoms are? If you click here, you'll be taken to a video where I talk about the signs and symptoms and explain them too. How to recognize them. Take care.